everyone, Dr. Donahue here. I'm with Sarah. She's going to be with us demonstrating some stuff, hanging out. So what we're going to talk about today is shoulder pain and why we get shoulder pain. So there's a lot of reasons why we get shoulder pain, but a couple things to figure out right away is where you're having your pain and what kind of pain it is, so we can get the right diagnosis and the right treatment. So the first thing is the location of the pain. Are you feeling it more on the outside? Is it more deep? Are you feeling it, can you point to it more, or is it more widespread? So that's going to lead us in different directions. The other thing is describing the pain. So there's a couple different types of pain. There's somatic nociceptive pain, which is more of the achy, sharp, dull pain that we get. Tends to get worse with movement, better with rest. You can kind of point to it, it's more localized. This is the more mechanical pain that we treat often. So a lot of the shoulder conditions that we see is going to be this type of pain. The other type of pain is neuropathic pain or nerve pain. So the first pain is coming from your soft tissues, your muscles, ligaments, joints, tendons, bones, fascia, stuff like that. The second type, the neuropathic pain, is nerve pain. And the reason I wanted to bring that up, this is going to be your tingling, your burning, your pins and needles, your electrical sensations, stuff like that. And I wanted to bring that up because sometimes when we're having shoulder pain, it can actually be coming from the neck. So you get like a cervical radiculopathy stuff, or like a sciatic type pain in the back of your leg here. That's going to be that type of pain. But sometimes that'll present as shoulder pain if it's coming from the neck, but really it's not the shoulder what's the issue. It's the neck. Okay, so now that we covered that, the most common reasons that we get shoulder pain is from overhead, repetitive flexion, overhead activity, and reaching behind our backs. So this is going to be like your overhead throwers, volleyball, baseball, swimmers, weightlifters that do a lot of cleans, a lot of snatches. And then as far as the workplace goes, we're going to have like electricians, carpenters, painters doing a lot of this stuff. So it's going to be that flexion and that internal rotation stuff. And that can lead to what we often see in here is impingement symptoms. And that's going to, so going back to the two types of pain, it's going to be the more mechanical pain, the somatic pain, right? The achy, sharp, dull stuff that you can point to, you can localize it. Things of that nature. So normally when we go flexion and then we go internal rotation stuff, that's going to start to cause those impingement syndromes where this arm bone here starts to ride up into the actual shoulder socket, and there's a supraspinatus tendon that goes through here, and it doesn't give it room to move, so it can lead to things, and it often coexists with things like rotator cuff tendonitis, tendinosis, where there's actually fraying of the tendons, biceps tendinopathies, labral issues potentially, a lot of stuff that can go on. So next video we're going to go over some actual tests to see if we have some of this stuff. So you can do these at home. Some of these you can do at home, just to kind of demonstrate an evaluation, see what's going on, things of that sort. So come back next week, or later this week, maybe later this week, and we'll demonstrate some of that stuff. You can try some of this stuff at home. So don't forget, like and subscribe, comment below for things you want to hear about later, and we'll see you either next week or later this week.